You're watching this video because a doctor wants you to understand what's involved in a decompressive craniectomy. A stroke has already affected part of the brain. Some irreversible damage may already have occurred. The brain is now swelling dangerously and exerting pressure on surrounding healthy parts of the brain and risks causing further damage. The purpose of this emergency surgery is to prevent further injury to the brain. It cannot reverse any existing damage to the brain. The patient is usually positioned on their back, side, or front, depending on the location of the stroke and swollen brain. A metal head clamp may be used to hold the head safely. Some of the hair will need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will again vary depending on personal requirements. To begin, a cut is made in the skin of the scalp. Special drills are used to make a number of holes in the skull. A special bone saw with protective footplate is used to join the dots, and a window of bone is opened. The incision and bone window will vary in size, shape, and position, depending on the patient's personal requirements. It's usually bigger than the example shown in this video. The tough lining around the brain, known as the dura, is usually opened to make more space for the brain to swell safely. The surgeon may lay it back loosely or use a synthetic replacement for further protection. To finish, the surgeon will close the scalp with stitches or staples. There may be a drain left in place to drain off excess fluid from the surgical site, which will usually be removed in the first few days after surgery. There's usually a wound dressing, and a head bandage may be applied as well. Please ask the neurosurgical team for a personalized postoperative plan after the procedure has finished. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.